The 3 shots have been fired in Daly Plaza. The presidential motorcade reaches Parkland Hospital at 12:36. Some of this we've already told you. We said one of the men who witnessed this horrific event at Parkland Hospital was Texas Ranger Milton Wright. And Ranger Wright was riding in the 5th car of the motorcade with Dallas Mayor Earl Cabell and his wife, which followed the presidential limousine to Parkland Hospital. It was Milton Wright who helped lift the wounded Governor Conley out of the limousine's jump seat and onto the gurney that took him into the hospital for emergency care. He was in the 5th car. Yeah, okay. Now, we said that Milton Wright was later quoted as saying, as soon as we got him, meaning Conley, out, a Secret Service guy ran up in the car and pulled the president over to one side. I could see partially the side of his head was gone. Trooper Wright was then asked to help put President Kennedy on a gurney, and then he stood guard outside the hospital. Now, we mentioned that the president was removed from the limousine after some protest from Mrs. Kennedy, and after seeing the Zapruder film yesterday, as we mentioned, you can understand why she was not eager to have the president thrown on a gurney with his head uncovered. I mean, it was a very grotesque sight. And it took Agent Clint Hill some time to figure out exactly what she meant, and when he did figure it out, he took off his sport coat and covered the president's bloody head, and then Jackie allowed Clint Hill to remove the wounded president and take him into hospital. Now, a witness to that event, this is kind of an interesting story, and witness to the protest by Mrs. Kennedy was a nurse by the name of Phyllis Hall. Okay, Phyllis Hall. And she was a witness to what I just talked about. And Nurse Hall was there outside the emergency room, and she was asked to obtain the gurney that would take President Kennedy into Parkland Hospital. So she witnessed this protest on the part of Mrs. Kennedy and Clint Hill figuring this whole thing out, and then she was asked to go get a gurney and race it to the presidential limousine, and she witnessed the president being removed from the limousine and put on that gurney and taken into Parkland Hospital. And it's an interesting scenario. She's got another part in this whole thing later that we'll talk about. Now, we talked about Senator Ralph Yarborough. Remember, he was riding with Vice President Johnson and Mrs. Johnson, and their limousine also followed the presidential limousine to Parkland, and this was what Senator Ralph Yarborough was later quoted as saying as he stood outside. And a lot of these videos we've shown you, you can see Senator Yarborough in those videos wiping his eyes from tears from the assassination. He was a big fan of President Kennedy, but he said, the minute the car stopped, the Secret Service rushed at Johnson and formed a circle around him. I heard one of them say, Mr. President, to Johnson, and at that point, I knew Kennedy was dead. That was his quote outside Parkland. Yeah.
She would have died even if the shot was just his head.
A lot of people say he would not have. That he probably would have been handicapped in some manner, but probably would not. Okay? All right, that takes us to our next subtopic then on this new sheet I gave you. This is very important. Events at Parkland Hospital. So the president's limousine has reached Parkland Hospital. He and Governor Conley have both been put on gurneys and taken inside Parkland. So events at Parkland Hospital. President Kennedy was immediately rushed into Trauma 1, which was one of several emergency rooms at the hospital. So when the gurney was taken into the emergency room, President Kennedy was immediately rushed into Trauma Room 1, an emergency room at the hospital. Now I have a whole group of physicians here that we're going to talk about that worked on the president. The first physician to see President Kennedy was Dr. James Carrico. He was just 28 years old, and he was a resident in surgery. Very young doctor, very good doctor, but the first physician to see President Kennedy was Dr. James Carrico. He was 28 years old and a resident surgeon at Parkland Hospital. And this is what Dr. Carrico reported after examining the president. This is what he wrote in his notes after he examined the president. So the first physician to see President Kennedy at Parkland Hospital in Trauma Room 1 was Dr. James Carrico, 28-year-old resident in surgery. And these are the 4 things that he reported after he examined the president. Number 1, he noticed a small wound at the anterior neck in the lower 1/3. He noticed a small wound in the anterior neck in the lower 1/3. Where's your anterior neck? Okay? Second thing that he noted was one wound that shredded the brain tissue which had profuse oozing. This is what he wrote in his notes. Number 2, one wound that shredded the brain tissue which had profuse oozing. So he's talked about the first and third shot. Number 1, a small wound of the anterior neck in the lower 1/3. That was the neck exit wound. And 2, one wound that shredded the brain tissue which had profuse oozing. Third thing he reported is he had no pulse or blood pressure present. No pulse or blood pressure present. That was the third thing he noted. No pulse or blood pressure present. And the fourth thing he noted was the president's pupils were dilated and fixed. He noticed the president's pupils were dilated and fixed. The man who assisted Dr. Carrico was Dr. Don Curtis. This guy right here. Dr. Don Curtis was the man who assisted Dr. Carrico. And he was the man who unbuttoned President Kennedy's bloody shirt so that Carrico could examine him further. So Dr. Don Curtis, who was assisting Dr. Carrico, was the man that unbuttoned President Kennedy's bloody shirt. And he also noticed the wound in the throat when he did so. As he unbuttoned the shirt, took off the tie, he also noticed this wound in the throat. Well, the next doctor that examined the president was 34-year-old Dr. Malcolm Perry. Significant part of history here. Dr. Malcolm Perry. This is him right here. Okay, Dr. Malcolm Perry. And he, with the help of Dr. Robert McClellan, this fellow right here, Malcolm Perry, with the help of Dr. Robert McClellan, immediately formed a trach in the president's throat in an attempt to improve the president's breathing. I actually spelled it on the sheet, I think, for you, didn't I? Okay? Tracheotomy, yeah. So it was Dr. Perry who actually performed the trach on the president with the help of Dr. Robert McClellan. And the reason Dr. Perry performed the trach is he wanted to make an attempt to improve the president's breathing. The unfortunate thing about it is he made the incision for the trach right over the bullet wound in the neck, which ruined any evidence, so to speak, of determining later whether it was an entrance wound or an exit wound. Because there are those that feel like there was a shot fired from the front. But it kind of screwed that up a little bit. But he didn't care about that at the time. Do you understand that? He was trying to save the president's life. So Dr. Perry performed the incision for the trach right over the bullet wound in Kennedy's throat, and Dr. McClellan held the retractor as that was done. So they tried to get him breathing. What happens after the trach? What did Dr. Perry do on President Kennedy after the trach, you health wizards? Performed CPR. And according to Perry's report, he was able to rise what was medically reported as a, quote, semblance of a heartbeat. That's what they stated. Fact was probably not. But they made every effort. I'm telling you, they just didn't look at him and say, ah, he's gone. So Dr. Perry performed the trach, and then he began CPR on President Kennedy and was able to raise what was medically reported as, quote, a semblance of a heartbeat. Well, as all this was going on, Dr. Ronald Jones, this fellow right here, Dr. Ronald Jones, had earlier established the intravenous line in President Kennedy's left leg in case they felt he needed blood. So all this kind of happens, boom. He gets in, Carrico looks at him, Perry comes in, performs. As all this is going on, as McClellan is holding the retractor for the trach, Ron Jones is establishing an intravenous line in the president's left leg in case he needed blood, and Jones also inserted a chest tube into the president. I mean, they're doing everything they can to try to get this guy alive, to obviously no avail. But they are making a tremendous effort despite the circumstances, frankly, because he is what? The President of the United States. So, kind of going back and make sure we understand. First physician was Dr. James Carrico. He examines the President. He reports a small wound of the anterior neck in the lower 1/3. He reports a wound that shredded the brain tissue which had profuse oozing. He reported he had no pulse or blood pressure present. He reported that the pupils of the President's eyes were dilated and fixed. Dr. Don Curtis, who was assisting Carrico, was the one that unbuttoned the President's bloody shirt to be examined. And then he was examined by attending surgeon, 34-year-old Dr. Malcolm Perry, who performed a trach on the President's neck with the help of Robert McClellan, who was holding the retractor. And Perry began CPR, was able to raise what was medically reported as a semblance of a heartbeat. And Dr. Ron Jones was establishing intravenous lines in the President's left leg in case he needed blood, and also put the chest tube into the President. Well, Secret Service agent at this time, Secret Service agent Roy Kellerman, went into Trauma 1 to evaluate the President's condition. Remember, he was the one in the motorcade, right? He was the head of the Dallas detail of Secret Service. He was in the limousine, and he went in, he was kind of in charge from the Secret Service perspective, and he went into Trauma 1 to evaluate the President's condition. Once Kellerman saw the severity of Kennedy's wounds, he hollered out to agents to get a telephone line directly to the White House. So Kellerman comes in as they're trying to save the President's life to no avail, and he sees the condition, the severity of the condition of the President, and he yells out to other agents to get a telephone line to the White House immediately. Anybody want to guess which Secret Service agent secured the line? Clint Hill. So Secret Service agent Clint Hill is going to secure this line between Parkland Hospital and the White House. And why are they calling the White House? To give an update on the condition of the President. Well, as Clint Hill secures the line and was talking to the White House on the telephone, the operator, and you saw that we watched 13 Days how those operators works, she cut in and said to Clint Hill, the Attorney General wants to talk to you. Because Robert Kennedy's back at his home in Virginia when this all comes about. So as Hill is talking to the White House on the telephone, explaining the President's condition, he is interrupted by the White House operator who tells Hill that the Attorney General wants to speak with him. Okay? Now this is kind of and you'll get a chance to see Clint Hill tell you this story, but I'll tell you what happened. Robert Kennedy very simply just asked Hill, how bad is it? Simply ask him, how bad is it? And Hill, and you'll see he'll talk about this, he'll get emotional. He was quoted as saying, I didn't know what to tell him. I really didn't know what to say. I simply said, it's as bad as it can get. That was his response. So when Robert Kennedy first spoke to Agent Hill on the White House line, he asked him, how bad is it? And Clint Hill was later quoted as saying, I didn't know what to tell him. I really didn't know what to say. I simply said, it's as bad as it can get. Meanwhile, outside the trauma room 1 sits Mrs. Kennedy in a wooden chair waiting for news. Okay? But she already knows. But she's sitting outside the trauma room when she's confronted by a Dallas police sergeant by the name of Robert Bob Duger. Robert Bob Duger initiates a conversation with Mrs. Kennedy as she's waiting in a wooden chair outside Trauma Room 1 for news. The Dallas Police Sergeant Robert Bob Duger was involved in a conversation with the First Lady. And this is what he was later quoted as saying about his conversation with the First Lady as she sat outside Trauma 1. Quote, "She asked me if I had a cigarette." She was a smoker, didn't smoke a lot in public, but was a smoker. "She asked me if I had a cigarette, and I said, 'I'm sorry, I don't smoke.' She said, 'I have some cigarettes in my purse. Will you get them for me?' One of the Secret Service guys came over and said, 'Get your hand out of Mrs. Kennedy's bag.' And she put him down pretty quick." So picture that in your mind. This police sergeant comes up to Mrs. Kennedy to see how she's doing. She asks if he has a cigarette. He said he does not. She says, "I have some in my purse." Secret Service agent obviously doesn't hear this conversation, but he's there in the vicinity. He gets in his hand in her purse and gets a good chewing out. And she then sets the Secret Service agent straight that he's helping her. Well, after Dr. Perry's attempt to revive the president, it was very obvious that the situation was hopeless. It was hopeless before he came in, but they were doing everything they could. So finally, the man that makes the decision, who pronounces President Kennedy dead, is Dr. Kemp Clark. He is the head of neurosurgery. So as they're trying feverishly with CPR to get the president to show some sign of life, finally Dr. Kemp Clark, the chief of neurosurgery, steps in, and he basically said, "Hey, it's time to stop the resuscitation. This is incompatible with life." And he makes the decision that the president has passed away. Because these guys are trying feverishly to do this. Okay? Well, Mrs. Kennedy actually, between then and now, so to speak, had come into Trauma 1 to see on her husband. So she was standing right next to Dr. Kemp Clark, as was Phyllis Hall, the nurse that we had talked about, when Kemp Clark made the decision that the president was dead. So finally, Dr. Kemp Clark, chief of neurosurgery, was a person who pronounced President Kennedy dead by saying, "It's time to stop the resuscitation. This is incompatible with life." And standing next to Dr. Clark at that point were Jackie Kennedy and Nurse Phyllis Hall. Nurse Hall simply stated to Mrs. Kennedy, "I am so sorry for your loss." And once she stated that, she said that Mrs. Kennedy just stared straight ahead, didn't answer or hear her, and then Mrs. Hall, Nurse Hall, was asked to help prep Governor Connolly for his surgery. So she was there. Now here's the ironic thing. 3 weeks before the Kennedy assassination, 3 weeks before, Nurse Hall assisted in the birth of Marina Oswald's second child. True story. 3 weeks prior, Nurse Hall assisted in the birth of Marina Oswald, Lee Harvey Oswald's wife's second child. And we'll get into that later. Now, Catholics, how many Catholics do we have in here? Raise your hand. So after Dr. Kemp Clark pronounced the president dead, there was a delay in the notification of death. Why? That's right. Mrs. Kennedy wanted a priest to be allowed to give her husband the last rites of the Catholic Church. So even though Kennedy died prior to the official time I will give you, the official time was delayed because they wanted a priest to come to give the last rites. The last rites are usually given before a person dies, but Mrs. Kennedy wanted the last rites given. Now, the man that called the priest to Parkland Hospital, who was a doctor that was assigned to work with the Secret Service during this ordeal, was Steve Landgren. This guy right here was the guy that called for the priest to come to Parkland Hospital to give President Kennedy the last rites. So again, there was a delay in the notification of death because Mrs. Kennedy wanted a priest to be allowed to give her husband the last rites of the Catholic Church. And Dr. Steve Langren was working with the Secret Service agents throughout this entire ordeal, and he was the man that called the priest to Parkland Hospital. And at 12:57 p.m., 12:57 p.m., Father Oscar Huber and his assistant, Father James Thompson, arrived at Parkland Hospital. Here is a picture and signature of Father Oscar Huber right here. So at 12:57 p.m., Father Oscar Huber and his assistant, Father James Thompson, arrived at Parkland Hospital. And Huber administered the last rites for President Kennedy. So at 12:57 p.m., Father Oscar Huber arrived at Parkland Hospital with his assistant, Father James Thompson, and Father Huber administered the last rites. This is, and we've got a lot of quotes here, I just want you to listen because they're really interesting. This was Huber's quote later about his experience. He said, "He was covered with a sheet, which I removed from over his forehead before administering conditionally the last rites of the Catholic Church. Mrs. Kennedy bent over and seemed to kiss the President. During this most trying ordeal, the perfect composure maintained by Mrs. Kennedy was beyond comprehension. I will never forget the blank stare in her eyes and the signs of agony on her face. In a low voice, she thanked me graciously and asked me to pray for the President." That's what he remembered. How about Father Thompson? After the last rites were administered, this is what he stated. "I went to the President's wife, took her hand, and in the best way I could, offered my condolences. Having just left Parkland, suddenly I was aware that my right hand was sticking to my steering wheel. Then I realized I had the